Hi, so are vitamins good for you? Should you be taking them? It was a really good question from Gwen, and what we did was Gwen sort of actually brought in what she's taking. So she's taking a few things here. We've got sort of a vitamin B complex. We've got she's vegetarian, so she takes an omega-3 from algae, and also the infamous vitamin D as well, which is something which is recommended for all of us. I mean, B vitamins, really good idea. It's they're essential for our body in so many ways. All the different types of vitamins have their own role, their own function, and certainly sort of one of the most recent studies on cognitive health showed that taking a B6 and a B9 along with omega-3 fats, especially DHA, was really good for improving cognitive impairment, so unfortunately the old dementia. So vitamin B complex, really good. It's also for carbohydrate and protein breakdown in your body, for just getting your nervous system to work. But what we really need to pay attention to is what's actually inside there. So if we look at the ingredients, what we're looking at is the first ingredient is a bulking agent, dicalcium phosphate microcrystalline cellulose, and that is the primary ingredient in this container, in each tablet. And then you've got nicotinamide, calcium, D-pentaphenate. Nicotinamide is a B vitamin, calcium, a D-pentaphenate, and pyridoxine is another one. Then you've got hydrochloride, and then you've got an anti-caking agent called magnesium stearate. So remember that, because we're going to talk about that in a minute. So this contains magnesium stearate. This one here contains magnesium stearate, and most tablets will, because magnesium stearate is used by the tablet industry as a flowing lubricant to make those tablets to sort of go through the conveyor systems much quicker. But let me tell you a little bit about magnesium stearate. So the side effects of magnesium stearate include gastrointestinal issues like diarrhea and irritation, especially with excessive intake. There are concerns about its impact on immune function, potentially weakening T cell function, which is obviously a primary part of your immune system. It's one of the controlling sort of cells. Additionally, worries exist regarding pesticide residues, nutrient absorption and biofilm formation in the digestive system. Some reports suggest that magnesium stearate may hinder intestinal absorption due to its hydrophilic nature. Concerns have also been raised about its potential negative effects on cholesterol levels and immune suppression. While it's generally considered safe in small amounts, it's essential to be cautious about the quantity consumed to avoid diverse effects. So that's magnesium stearate, and if you go and look at your vitamins and minerals that are meant to be really good for you, you'll find that the majority of tablets will contain magnesium stearate. So it is something to be avoided. So start looking at the ingredients. Do start looking at the ingredients. It is so important. And if there are things in there that you don't realize, and remember that with any list of ingredients, the first largest ingredient is always the first. So in both of those, it's bulking agent. In both of them, it's bulking agent. So is that something you really need? And the answer is no, you don't. Obviously, so capsules don't, but then capsules, you've got to look at what is actually in the capsule. The other thing that I'd really want to mention about this vitamin D here is that it also contains a cyagun, which is a thickener. It contains sucrose, sugar, also contains sunflower oil and cornstarch as well, and cholecalciferol. So do you really need those along with your vitamin D? And I would say to you, no. Yeah. Now, Gwen has been just started taking a new range of supplements, and I'm not here to promote them, but I am here to tell you that they're called Clean, and it's a British supplement company, and the ingredients are really good. Certainly in what we've got here, the turmeric, the boswellia and the coenzyme, there seems to be very little else in them, and they're all capsules. They're all capsules as well, so they're not compressed and don't need the magnesium stearate or the bulking agent. So do please have a look at the the ingredients of any kind of vitamins or anything that you're putting in your body, because yes, it's a great idea to take them, but then, you know, what else are you putting in your body that you don't actually need? So highly encourage you to do that. And Dr. Sandhu here from Bedford Chiropractic Clinic with my wonderful patient Gwen, and that was a question that Gwen asked. She asked me to have a look at it, so that's my feedback to you and to Gwen as well. And all I'd like to say to you is that here at Bedford Chiropractic Clinic, not only do we sort of give you the best chiropractic care that we can, but having looked at and studied nutrition over the last 25 years, if you want to sort of speak about nutrition, then give us a call. And I'm very happy to sort of do a Zoom consultation with you and have a chat with you about sort of how potentially I could help you improve your eating plan and also look at some of the supplements you might be taking. So, Dr. Sandhu, Gwen, thank you so much. I really appreciate you. Thank you.